You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining and listening to the Dental Zone podcast. I'm going to be talking about those hidden things, the dangerous little nasties that are lurking in your silver metal fillings. So let's get to it. Let's get in the zone. Hello, I'm Dr. Rachel. I'm a dentist, and today I want to talk to you about the hidden dangers in your fillings. I'm going to explain about a fascinating radioactive sheep study. I'm going to talk about some of the shocking symptoms that you can develop because of your fillings, and I'm also going to explain the smart way to get them removed. Now, how many of you have got those old silver fillings in your mouth? Now, if I said to you, you should get those removed, a lot of you would be like, yeah, well, they don't hurt, I'm not having any problems. Well, from over 30 years of experience, I can tell you almost 100% of the time when I take those fillings out, there is decay underneath them. But I'm a holistic dentist, so I'm more concerned about what's in your fillings than what's underneath them. And the reason is because those fillings are made up of metals that are actually detrimental to your health. So let me tell you why I'm concerned about what's in your fillings and what those hidden dangers are. Well, those silver fillings are actually a product called dental amalgam, which dentists will tell you are silver fillings. Now, the reason we say they're silver is because they're silver coloured, but they actually contain silver, tin, copper, zinc, and 50% mercury. Now, mercury is a highly toxic heavy metal. It's very detrimental to your health if you ingest mercury. Now, dentists are told the mercury is bound within your filling, but that mercury actually leaks out as a vapour every time you get any warmth, heat or friction on those fillings. So that mercury is coming out, it's being absorbed into your body. But you don't just have to take my word for it. There have been numerous studies that prove that the mercury comes out of those silver fillings. There was a sheep study done where they mixed radioactive mercury into the amalgam filling. They placed that into the teeth of the sheep, and then they measured where the radiation was in the sheep's body with a radiation tracker. Now, when they did that, they found very high levels of mercury in the liver, the stomach, the kidneys, and more alarmingly, the brain. Now, our brains are like mercury magnets. Now, it sucks that mercury in, and once it's in there, it starts to short-circuit the brain, it damages the brain fibres, and it actually causes them to shrink. No different to Alzheimer's or dementia, it has that same effect. As you can imagine, that's quite serious. And what impact is that going to have on your health, let alone your brain function? Now, the issue with mercury vapour is you can't see it, you can't taste it, and you can't smell it because it is odourless, flavourless, and it is invisible. Now, if you're going to get symptoms of mercury poisoning and mercury toxicity, it builds up over time. So mercury is coming out of your fillings as a vapour and it's building up in your body. Now, this impact depends on how many fillings you have. So the more you have, the more mercury you're getting exposed to, the longer they've been there. So the longer that filling's been there, the more time the mercury vapour has been coming out into your body. So the other things that are important is the amount of times you stimulate those fillings. So how often are you chewing, eating, drinking, clenching? If you chew gum, you're going to be having big problems. So it's also how you stimulate them. You know, someone who doesn't eat as much or as often is going to have less mercury vapour. If you clench and grind your teeth during your sleep, you're vaporising mercury. Now, this increases the risk of symptoms. So if you've got lots of fillings, they've been there a long time, you have lots of hot drinks during the day, and you clench and grind your teeth, you are seriously increasing your risk for mercury symptoms. Now, mercury poisoning is very serious. Now, mercury builds up over time in your body, and your amalgam fillings are a never-ending supply of the stuff, drip feeding it into you. So what happens is, you've got your mercury filling, you're chewing, you're clenching, you're grinding, and that's releasing vapour. So you chew, you clench, hot drink, and then, drink, this goes out of the filling, and then you've got mercury dripping out of that tap into your body, and then you're not very happy, and then you feel unwell. Now the problem with mercury is because it builds up slowly, you don't realise that you've been affected by it until you are dangerously poisoned. Mercury poisoning causes a whole range of symptoms. Symptoms such as depression, insomnia, fatigue, low energy, heart problems, appetite loss, headaches, weight loss, immune system issues, nervousness, anxiety, weakness, skin problems, hearing loss, tremors, and even loss of memory. Now, the only way to minimise this exposure or reduce it or remove it completely is to have those silver mercury amalgam fillings removed. Now, I don't want you to just rush out to any old dentist to get that done, because it has to be done safely. The biggest time of exposure from mercury fillings is when they're being placed by the dentist and drilled out by the dentist. So you need to make sure that you find yourself a smart dentist. And I don't just mean smart intelligent, but smart as in smart certified. SMART stands for Safe Mercury Amalgam Removal Technique. So please, I urge you, if you have many silver fillings in your teeth, or even if you only have a few, to consider getting them removed, and make sure you find yourself a smart holistic dentist. So if you think that your tiredness, your fatigue, your low energy, or your chronic health problems are just a normal part of aging and life, I urge you to think again, because it just could be the hidden dangers in your mercury silver fillings that are making you sick. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. I am a SMART certified dentist, and I have had 20 years of removing amalgam fillings, specifically for patients who request me to do so because of their concerns about mercury in their mouth and the impact that that is having on their health and well-being. In my 20 years working holistically, I have removed probably around 30,000 amalgam fillings, helping thousands of patients achieve mercury-free, metal-free, healthy mouths. If you'd like to know more, hop on over to holisticdentistry.au, or you can give my practice a call and we'll book you in for an amalgam removal consultation on 0737 20 1811. And if you'd like to send in your questions, suggestions and ideas for topics for the Dental Zone podcast, the email is info@holisticdentistry.au. We look forward to hearing from you, and thank you very much for being with me in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness and a great smile, get in the zone.